Thanks, Steph. Thanks for the introductions to the session. So to recap then, so this evening's session is regarding mental health and resilience in a health crisis, which I think it's fair to say is relevant for all of us over the last few months. So the session will involve two speakers this evening, one who's a specialist physiotherapist who's had some very unique experience recently, and the second is a head of staff experience. I will speak to each of those people in turn, and then we will have a group discussion. And at the start of the group discussion, we will use the Mentimeter poll that Steph mentioned. So you'll be prompted to do that, and we will look at the results from that coming through in real time. We will then have about 15 minutes for a live question and answer session, and we're keeping an eye on the questions as they come through. So please submit anything that you're interested to ask. So to start with then, I would like to introduce Fern Higgs. So Fern is a specialist physiotherapist in rheumatology and has been for the last 8.5 years. She started in East Lancashire to begin with, and then moved to University College London about 3 years ago. And she's working there as a clinical specialist physiotherapist. She's had, as I mentioned, some unique experience recently. She was part of the wellbeing team at the Nightingale Hospital, part of the education faculty at the O2. And she's hoping to secure a place this year on the Clinical Mental Health Sciences MSc at UCL, which I'm sure she will be successful with. So welcome, Fern. Thank you for joining us this evening.
Thank you very much.
And so to kick off then, tell us all a little bit about your role at Nightingale.
Okay, so my role at the Nightingale. So I was basically, the trust seconded me for 2 days out of my normal kind of 5-day full-time work pattern to go and join the education faculty at the Nightingale. So I joined a little bit later down the timeline. So the whole kind of rapid curriculum that was developed for the Nightingale staff had already been developed. And when I joined the team, my role there was to help kind of facilitate and deliver one of the core lesson plans, which was the psychological PPE. So obviously throughout the pandemic, there's been a massive push on our kind of physical PPE. Obviously, that's very important with regards to kind of protecting ourselves against the virus. But there was also a massive push when they were making the curriculum that we needed to protect our staff. So there was a massive kind of staff physical and psychological wellbeing drive. And the whole idea behind the psychological PPE was we wanted those members of staff that were going to be going to the Nightingale to really look after themselves, as well as obviously putting the patients first, which we always do, but we have to invest in ourselves to be able to do kind of that job the best we can. So I joined the team, like I said, a bit later down the line. So all credit goes to Chloe Kitto, who is an occupational therapist at Stanmore Hospital, and Krishna Bakhai, who's a GP, because they were the ones who created this lesson plan. So I'm just going to hopefully share my screen, because Health Education England have actually shared all the Nightingale resources. So they found that it was really useful, kind of what they developed. It worked really well, and they've done it so that kind of local trusts can try and adapt it as much as they want to. So hopefully you can see my screen there.
Yes.
Excellent.
Yay.
So this is going to be a massive whistle-stop tour, because I could definitely talk for way too long about all this. But basically, the whole point about this session was thinking about the clinicians and their kind of preparedness of going into this really unique kind of field hospital setting. So for the majority of us, none of us have ever worked in a field hospital setting, and particularly for a lot of us, we haven't been involved in such a pandemic as we're kind of experiencing at the moment. So we wanted to make sure that our staff were kind of well looked after, and almost tried to prepare them for what might happen when they kind of stepped foot into the Nightingale at the Excel. So this was kind of the crib sheet that Chloe and Krishna kind of created that we used. I can't get it all on my screen, so I'm just going to get rid of the little Nightingale there. So just kind of running through what we did in the sessions, we wanted people to think kind of pre-COVID, what they did to keep well. So sometimes this is something that people don't even think about, kind of what they do for their own mental health, their own well-being, kind of how they look after themselves. So we wanted them to first think what they would normally do if there wasn't any restrictions. The lockdown hadn't happened by this point, kind of what would you normally do? And then we wanted them to think about, okay, kind of stepping into this new environment, what might be those stresses that you might experience at the Nightingale. So we wanted to think globally, kind of what physical stress is. So, you know, working long hours in PPE. Environmentally, it's a very different setting. It's a field hospital. Even if you've worked for years on an intensive care unit, this was very different what you were going into. Socially, how it was going to impact kind of on your home life, kind of all our normal social lives, and also kind of those emotional stresses that we might experience in such a setting. And then what we wanted to think as well was kind of what their early warning signs would be. So the main kind of theme that we were trying to promote was we wanted everybody to check in with themselves. And this is a really good kind of well-being technique that all of us should hopefully be doing, where you actually kind of take that step back and think, how am I managing? How do I feel today? How might this impact on me? You know, what do I need to do? How do I need to do things to try and cope with this? So again, we wanted people to kind of look back and think about what their normal kind of early warning signs are. So be them physical, behavioural, thoughts, feelings. So obviously there was lots and lots of different things talked about here. Some people withdraw, some people become more snappy. Because as well as them checking in on themselves, there was also a buddy system at the Nightingale. So you always worked in kind of pairs. So you also wanted to look out for your colleague as well. And if you started to think they don't seem like they're coping, what can I do to help them and how can I kind of look after them? And then really it was thinking about those coping strategies that we did pre-COVID. How can we now do during COVID? So, you know, lots of people would say they usually would go to a gym. Obviously that couldn't happen anymore. They might go and visit family and friends. We were in lockdown, we were socially distancing, that couldn't happen anymore. So we wanted them to think kind of how can they change what they do in this kind of COVID time. And that's what that bottom timeline there is. The Zoom thing just goes over it. So your psychological PPE, and it was thinking about as they were donning their physical PPE, before they were going onto their shift, we also wanted them to don their psychological PPE. So like I said before, checking in how you feel, checking in on your buddy. When they had regular breaks, we had wellbeing spaces, we had wellbeing walkers on the floor that they could go and talk to, psychologists in the building that they could go and talk to if they needed to. And then also getting them to think about when they were doffing their physical PPE, to also doff their psychological PPE. So not necessarily ignoring what had happened, maybe some kind of traumatic experiences, but really to think, you know, how can I deal with this and not take all of my kind of Nightingale role home with me? We wanted people to still remember that they're still themselves and they still have a life outside of the Nightingale, because these were long hours they were working, long shifts, and it was going to be in a very stressful environment. So that was kind of the main kind of premise of what the psychological PPE was. I joined in it so late, and kind of the success of the Nightingale, it went into hibernation obviously earlier than we were expecting, which is obviously a positive, because it's quite nice that we didn't have to use it in the way that we wanted to or thought we would have to. But it also meant my time was cut short there, and I really enjoyed what I did with the team. And we've had really good feedback, and it's something that hopefully now is being rolled out more across the NHS. So I know that Chloe and Krishna are still working with Health Education England to kind of work on this kind of transformation package and really kind of pushing the psychological PPE back into local trust, not just related to COVID-19, but just making sure that we're looking after our staff in a kind of normal hospital environment as well. So it was a really good time, albeit short, and some really good feedback, particularly from that kind of lesson plan.
Yeah, well, I mean, it sounds like there's been a lot of preparation that's gone into, you know, making sure that people are fully prepared for the roles that they were going to take on, and then actively reviewed throughout that role. So can you give me some examples or experiences of particular struggles of mental health in healthcare professionals that you saw during your time there?
Yeah, definitely. So there was loads and loads of things that obviously came out of our psychological PPE sessions, but also back in my own department with my own staff, there was lots of different themes, lots of different thoughts and feelings kind of flying around. And I think they kind of mainly sat into two camps. So we had our colleagues that had to kind of sit in the working from home camp. So that could have been from a clinical point of view. So they might have been more admin based staff that actually, when we were trying to reduce the footfall in the hospital, we were trying to get as many people to work from home as possible, want to protect them so they didn't have to travel into work with the risk of possibly catching the virus, and also reducing how many people were in the actual hospital. And for some people, they've loved working at home, and for some people, and even kind of wider companies in the country, that might be something that they do even more so now. But actually for some people, kind of having that enforcement of working from home on them, a lot of people really miss that kind of social side of coming to work, kind of being able to talk to your colleagues, kind of escape home life. Sometimes that's your kind of your peaceful time when you're at work. A lot of people reported that they felt isolated. And also some of those working from home were our colleagues that needed to shield. So again, there was a big push that we wanted to protect our staffing, and some people from the shielding recommendations would sit in that kind of shielding category. And for some colleagues, it might have been that they hadn't widely amongst their colleagues shared their kind of medical condition, or for example, if they were newly pregnant. And that was also, again, a bit of an enforcement. All of a sudden they weren't in work. Obviously, there's confidentiality and it's not kind of widely publicized, but people notice that they're not in work, so then questions arose, so people might have felt a bit uncomfortable about that, and that's some things that came up. The other camp is those that obviously were redeployed, be it at the Nightingale or be it in kind of their local hospitals. So within our staff, I'm mainly based in an outpatient setting. It's been many years since I worked on an inpatient ward, let alone respiratory, and I was redeployed for the days that I was back in the hospital up onto the COVID wards. And some people found that they found it quite fearing being in that kind of new environment that they've not been in, working with teams that they've not worked. So everybody was redeployed from everywhere. Everyone was in kind of this new setting. So, people found that really strange and really struggled with that. There was also reports of people, how they felt they were perceived by kind of family and friends. So we've kind of had this hero complex, which we talked a lot about with the Nightingale staff, that quite nicely, obviously the general public have kind of really noticed how great we are in the NHS, maybe appreciate a bit more what we do and understand a bit more what we do. They obviously did the Thursday claps, and we've had all the NHS Heroes hashtags, which some people have found really lovely, and it's been great. Actually, for some people, they found that a massive pressure, and they didn't necessarily feel like a hero, because for most of us, it's just what we do day in, day out. Even if we were redeployed, we're still trying to care for patients in the way we normally would. So some people felt a bit of pressure from that. And also some people felt kind of family pressure. Some families were really supportive. You work in the hospital, that's great. You're going to the Nightingale, that's fab. But a lot of people reported that they also had the opposite, where family members thought, actually, why are you putting yourself at risk? You shouldn't be doing this. Or if you are going to put yourself at risk, then we really don't want to be anywhere near you despite social distancing. So there was lots of kind of flips of the coin. Some people would say, oh, this is a massive positive that's coming out of what we're having to do. And then some people on the side, that would be their biggest negative about it. So it was lots and lots of things. I think another massive theme that came out, particularly for me looking after my staff that got redeployed, was their experience of death. So again, working in healthcare, it's not something that we've not experienced, and we might also all have our own personal experience with death. But again, in the pandemic, even if you're the most qualified, long-standing intensive care member of staff, we all know that all the intensive cares had to rapidly increase in size. So even if you're used to seeing death, you're seeing death on a massive scale that's beyond what most of us have ever experienced. So that was one thing. And also the grieving process. So, a lot of our patients that were in their kind of end of life weren't having that usual end of life experience, because, family members weren't regularly allowed to visit. Obviously, as clinicians, we're in full PPE, which is really not personal. So we're trying to give patients the best end of life experience. And a lot of clinicians found that really hard, that what they would want their own family members to experience, people weren't able to experience. So that was a big thing that we kind of made sure we checked in on staff, how they were coping with that and things like that.
Mm. And do you feel that, obviously, clinicians are used to making decisions. Do you think that there was a different feeling around the decisions that were having to be made that may not be completely within their control, perhaps within this period, and also in the context of everything that surrounds this pandemic? Do you think that was that something that you were seeing that staff were struggling
Definitely. I think a lot of staff felt that they couldn't perform to kind of the clinical standards that are usually used to, and that was fully through the enforcement of what was going on with the pandemic. So if we think about kind of our outpatient setting, so as soon as kind of mid-March, we realised that the peak was very likely to come, and we had to suddenly decide how we're going to manage this as a trust. One of the first things we did was kind of close down the majority of outpatient settings. So, that was really hard, that, these patients are still really, really important to us, even if they're not part of the kind of COVID cohort, yet we can't give them the care that we want to. We couldn't see people face to face. Majority of the outpatient clinics, so particularly from a physiotherapy point of view, we went to a really skeleton staff, just doing phone calls to begin with kind of what we'd class as urgent patients, so kind of more of our recent post-op patients. So people found that really hard. And that was another thing that we really spoke about in the psychological PPE sessions with the Nightingale staff, that those decisions they might normally be able to make very quickly and very easily are all going to be very different in that different environment, with different colleagues, with kind of, these ceilings put on what we were able to offer.
Yeah, absolutely. And so looking forward over the coming months, what do you think needs to happen, and how can we carry on looking after ourselves and our colleagues and our friends over the coming months and year?
So I think that's really, really the key question at the moment, and I do feel like it's being really looked into, which is great. And I know I feel very lucky being based at UCLH, because I feel like our staff psychological and welfare team have done a great job kind of throughout the peak, and I feel lots of the things that are going to carry on that have been happening, and I know Jane will be talking quite a bit about what we've done at UCLH, so I won't talk too much about that. But I think, we're kind of going into this transition phase now, where we've had this peak, we've had all this kind of adrenaline, having to deal very quickly, rapid response to the pandemic, to now almost being in this lull where some people feel it's kind of a bit of a post-COVID stage, even though we know it's still around and it's still a risk. But it's almost this kind of living with COVID stage. So, we see it all over the media, we see it in all our emails at work. We're kind of trying to navigate through this kind of new normal of how we work whilst COVID is still happening. And again, I think there's loads of things that we need to be carrying on with, but I think there's kind of two main streams that are kind of going to happen from this stage. So we're going to have those colleagues and members of staff who found the past 3 months really, really hard. And people are going to cross over with these two streams, but, they found the past 3 months really hard, really traumatic, lots of changes. And what we're doing as a trust at the moment, which are carrying on wellbeing sessions that we were doing through the peak, except now they're kind of looking at, reflection over the past 3 months, kind of processing what's happened over the past 3 months, unpacking those thoughts and feelings that actually during that kind of fight or flight stage, we might have just kind of repressed just so we could turn up for work, do our best, go home, kind of carry on and repeat. And now we're kind of going through this lull and having a bit of a chance to step back, maybe going back to our kind of normal working areas, is kind of looking back and thinking, oh my gosh, now all my thoughts and feelings are actually coming through. So we really need to make sure that we're looking after staff, kind of, looking into that side of what's happened. And then we've got the kind of other stream. So some people might find that now, they felt that actually I had really good coping mechanisms. I felt really supported by my colleagues, the trust, the kind of wellbeing sessions, all that jazz. But actually now they're going to go through that kind of, again, kind of pre-COVID stage where, yes, we're in this lull of living with COVID, but we've still always got that threat that we're going to have another surge. Particularly, we're talking a lot about what's going to happen when the normal winter pressures comes, and are they going to kind of be more exacerbated because of COVID-19? So, we're going to have that camp of people that are going to be thinking, I'm absolutely exhausted. I've spent all my resilience techniques during the past 3 months that I just cannot bear to think how I'm going to manage if another surge happens. So we need to make sure that we're kind of looking after people from that sense as well. So yes, unpacking what's happened, but also thinking if we are going to have another surge, how do we
keep that support in place?
Yeah.
All right. Great. Thank you very much, Fern. It's been fascinating speaking to you and your experience over the last few months. We'll, if that's okay, you'll join us shortly for the group discussion and then for the Q&As, and I can see there's questions coming through, so that's great. Thank you, Fern. So I'd like to introduce Jane Keep now. So Jane is currently Head of Staff Experience at University College London and is Visiting Associate Professor of Health Services Innovation Laboratory at London South Bank University. So she's worked in the NHS as a manager for 41 years, including as head of organisational development in 2 large acute NHS Foundation trusts. She's been head of staff engagement, in addition to undertaking 20 years of freelance project and interim contracts in the NHS, working on board and leadership development, team coaching, staff engagement, and health and wellbeing and resilience. Also working with parliamentary select committees on national policy and in further education, local government and not-for-profit organisations. She's got a PhD in developing healthcare, self-care at work, and has also undertaken a research project with NHS Maternity Unit on how to develop and sustain self-care in a 24/7 service. So lots and lots of really valuable background to draw on, I imagine, given the recent developments. So Jane, thank you for joining us this evening. And welcome. So can you tell me a little bit about what your role has been and what your trust has offered over the pandemic, particularly for healthcare staff?
Yeah, sure. Thank you. Yeah, so funnily enough, in early March, I was doing a different role in the trust, and then it became apparent that there were other roles that were needed. And then also in that time, the head of staff experience post came up, and I was interviewed during the very peak as well and took on the job. But I've still carried on doing the other job I was doing, which was an organisational development practitioner supporting the moves to some of the large hospitals that we've been building recently. It was like going up on a roller coaster at the beginning in terms of what we needed to do. The early days, kind of mid-March, there was a sense of, well, we went to lockdown and London closed all the food facilities for staff. So we realized that staff needed to be fed. There's 10,000 staff, although not all of them are working on site. And my colleague and I were asked to feed staff. I've never done anything in relation to food in my life. And ended up finding some very generous anonymous donors and other people to support. And for 61 days at least, managed to distribute food across the trust to many, many of our staff. And that throughout that whole time, I was working 7 days a week and often about 70 hours myself. And I was doing that kind of thing. We also opened a respite centre. The Wellcome Trust were very kind and they offered us a respite centre for staff. We had to make sure it was obviously socially distanced and infection control was there to the best of our ability. But that provided a really, really amazing oasis for staff. And some days we had 700 staff that would come through that facility and they would have free food. There was a place where they could sleep, where they could rest, where they could play table tennis, where they could have psychology support. There was all sorts of things that was available, and in all my working life that was one of my dreams, and there it was then and there through the generosity of the Wellcome Trust. We had to sort out accommodation for staff that were needing to isolate from their families or live more closely at the time. I was lobbying government to change so we weren't paying congestion charge, lobbying Camden so we had free parking, everything that you could think that would mean that staff could come in and just focus on their patient care work. Myself and a number of colleagues were looking at. So we thought of everything. What do we do with childcare? What do we do about their travelling to and from work? What do we do about their accommodation? How do we make sure they're fed? Where can they get rest? Do they have lockers? Is there a staff area? What do they do if they have distress? And that, as Fern has already mentioned, we have a brilliant psych wellbeing team who did all that support, which was fantastic. And then we had problems like we would get all this food in and then we didn't have fridges or we didn't have microwaves or so then one thing led to another. And whilst these seem small practical things, when you've got that many staff and actually it's very intense, you have to very quickly work fast. And suddenly we were doing drive-through self-testing and someone rang me in the morning and said, Jane, can you make sure that we've cleared that road and it becomes a self-testing drive-through? I thought, I've no idea how you do that. But I made a few calls, and suddenly by the end of the day, the road was a drive-through testing area. So it was a very, very pragmatic can-do area. We got rid of all the horizontal boundaries. We got rid of all the who was the boss and who was doing this, who was doing that. We just rolled up our sleeves, and there was a massive amount of teamwork. And it was really, really impressive. We also did things like looking at debriefs and check-ins for staff, and daily comms and how staff kept in touch. And as was mentioned in one of the questions there, at some point along that, it became the BAME COVID issue, which is still very alive and well. And then the Black Lives Matter issue too, which are not really issues. They're very big things in our society that we need to look at. And so we started up BAME Q&As for BAME staff, which we did on MS Teams, and they've been very successful every week, or sometimes more than that. And we have started a BAME COVID working group. We've got a virologist and other people working with us. We've got risk assessments, for which we're really going very well with getting staff risk assessed. So with the extra piece about the BAME COVID thing, we then had to continue. So it was a constant reactive phase. And actually in the background, the last thing on this is that phase 4, which was our new hospital with the proton beam therapy that was due to open later this year, we had to pause it a bit because we couldn't get the builders on site for a while. But actually in the background, in the end, they were able to get the builders on site, because we realized if we had a second peak or whatever else happens, we actually needed that hospital to continue to open on plan. So we were planning in the background for phase 4. Do we have all the lockers we need? Do we have the rest areas we need? All the staff facilities, patient facilities in the building, and so on, whilst there was this very live situation going on for staff.
So balancing the, immediate need with what needs to happen to manage the COVID pandemic, as well as balancing existing services and, and progress that was being made on that front. So from your experience, what does resilience look like for healthcare professionals? And so, it's tricky, isn't it, striking that balance between being stoic and, then also being sensitive to the situation you're in and the patients that you've got and the situation that they're in. How does one balance that?
Yeah, and we're still learning, because this would be one of the biggest things that most of us have dealt with in our lives. But through all the years I've been working on resilience, I've learned with healthcare professionals that the level of fragility and vulnerability that you can allow yourself to be in is actually a very good protection measure, if you would call it protection. And being stoic, it doesn't necessarily, yes, there are times when you may need to actually not express everything that you feel you would, but being what would you say, stiff upper lip, is not necessarily always the way to go. I mean, I had days, and I had one particular day I remember, where I walked between organising the daily food for the staff. I'd had some calls around accommodation. We were worried in case there was a COVID outbreak in one of the staff accommodation areas, so we didn't know whether there was or not, but we were dealing with those things. There were a lot of things that were coming up every moment. I walked across the road, and I was walking across the road. There was a lady about to commit suicide off the bridge outside the hospital. Now, at that time, the whole of London was empty. There was no one around. There were just staff. And in fact, some of our staff were mugged, and we had to put pressure on the police to have more police in the area because it was very quiet. But I was just walking across to the respite centre, and I looked over, and a lady was standing up on the bridge as though she was about to jump off, and there was two other healthcare colleagues there, and we walked over, and we with the help of then another, we got the lady off the wall, and we walked around to ED, and I phoned ED in advance, and she went into ED, and we got that sorted. But actually, in terms of the reason why I'm sharing this with you is because these days were very intense and very long, and I got to the respite centre, and I walked in, and I just cried and cried and cried, and just felt that for my own resilience and for other people to see it was okay to feel like that, I just had to be in that very, very fragile state. And all that day, I felt extremely fragile, as did some of the other folks that were involved in that. So that example is really there to say what I learnt and learnt with supporting staff, because when we were in the respite centre, we had the chaplaincy, we had other people that were talking to staff. I was delivering meals, as were others, and we were talking with staff. I obviously wasn't on the front line like Fern and others were. But what I learnt about resilience is if we have the stiff upper lip and we're stoic, we bury stuff, and then we can start to feel unwell and not realise why we feel unwell. Our bodies get hard and tightened, and then we can get quite irritable and then quite desensitised. Now, I'm not saying that's wrong. I'm saying that sometimes that doesn't help the body, because it actually naturally doesn't want to feel hardened up and tensed and very, very tight. It wants to feel as though it can flow. And part of that flow is to really go, wow, this was intense. Wow, I'm feeling it's really full on right now. So that sense of that balance is very, very key with resilience. I don't really like the word resilience, although we've used it. There's something around how do we develop a level of self-care that allows us to feel free to be ourselves as best we can. And I guess the other thing I would just add is, how do you stay well in these things? And with the maternity services research that was done, there's some real practical basics for that whole time, which is about, was it, I don't know, 16 weeks or however long. I'm still working 60-hour weeks. And I didn't get sick at all in that time. And I haven't had any time off in that time. What kept me going were the basics as well. And this sounds really silly, and sometimes in busy environments when you're clinical, you can't do this, but how hydrated was I? How have I eaten? Did I go to bed when I could? Did I not look at social media? Because actually the press, I think, added to a lot of people's stresses and strains and pressures. And did I talk to someone when I felt I needed to? Did I call a friend or a buddy, or actually my coach? Because I had a coach, and I did call on my wise coaches during that time. And what did I do to support that? And I feel that also in talking to others, it was really, really important that the basics stand you in really good stead. If you let go of those basics, then you have no foundation to stand on. And the more you hold on to those basics, then the more you at least have some level of foundation to stand on.
It sounds to me like there's a lot about sort of feeling as though you have the permission to acknowledge how significant it's been and the impact that it's had on each of us, to then be able to kind of reflect upon it and, perhaps, know a little bit more about how one might deal with it if, there were to be a second wave, for example. So from the point of view of supporting healthcare professionals in relation to their well-being, what do you feel needs to be done now? And whose responsibility is that for those initiatives or policies? Where does that responsibility lie, do you feel?
Yeah. There were a lot of really good, as Fern said, a lot of really good foundations that were laid. I kind of wondered why we haven't fed our staff, why we haven't had more respite centres, why we didn't have more lockers, and no criticism of any hospital or any trust, but why hadn't we had accommodation in the way we had that people could use it? Why didn't we help them travelling to work more? Why don't we ease all those things that are outside of their working life that supports them to do the best they can? So my learning from this is, and the discussions we've had in the trust, is we have to keep some of those things going. I'm looking at opening a second respite centre, which may be temporary, but why wouldn't we have one? And why wouldn't we look at respite areas in the future? We need to look at how staff get food at night. We're looking at reviewing food and nutrition. We need to make sure that staff have lockers and have space for their belongings, so that they can not think about that when they come in. So there's some very, very basic things that we need to look at. And the psychology and other support mechanisms are super important, that we continue with those. The fact, obviously, in this environment, we've got testing and serology testing and risk assessments. I don't know why we've never had risk assessments to the extent we have them. We need them. We need them all the time. I don't mean we need to do them all the time. I mean, all of us need to know we can have risk assessments all the time as to where we are or what we're dealing with. So there's a lot of infrastructure we've got in that we need, we very much need to hold on to. But I think we need to wipe away some of the red tape and bureaucracy. And it disappeared for a while, and I can feel it coming back a bit. But that red tape meant that we could respond, just like the healthcare professionals were responding, just like that. We who support those healthcare professionals needed to be in the same degree of responsiveness. So my sense is we learnt a level of agility and adaptability as an organisation. It was absolutely stunning. It showed us we can do that. Well, why would we stop now? We need to carry on.
Yeah, absolutely, absolutely. Okay, all right. Thank you, Jane. There's so many points. I mean, we could talk all evening about so much of this, and I appreciate that. You know, this is a snapshot of something that you know, is much bigger than we have time for, unfortunately, this evening. What I think might be helpful is if Fern, you're able to join us again. If we now go to the Mentimeter poll. So Steph is going to show you the site for that and the login. And if you go to www.menti.com and then put in the code that you can see on screen, 815778, then there'll be 2 questions coming through, and we'll be able to see the responses to those coming through live. So we'll just give you a moment or two to see that site and the login code. And then, so question 1 is, what were your thoughts and feelings leading up to and during the COVID-19 peak? So submit whatever you feel was relevant at that time. So we're talking about the lead up to and then during the COVID-19 peak. And so we'll leave that on screen for a little while as things are coming through. So yeah, worried, insecure, anxious. Okay, so so perhaps Fern, whilst we're waiting for some of these to come through, so from the point of view of what do you think worked well in relation to staff well-being over this period?
I definitely think kind of well-being sessions where you got to either sit down individually or as a group to kind of discuss how you were feeling, kind of reflect on that day, that hour, whatever had happened. And I also think a big thing I saw was kind of the more kind of joining a team. So even though people were being redeployed out of their teams, I felt that it almost kind of reinforced and almost kind of reignited teams to almost bond again. I mean, I don't know about anybody else, but I have never been involved in as many WhatsApp groups as I have during this time. The busiest phone in the world, but it was just so lovely that even though, you know, members of staff were here, there and everywhere, that actually we still took the time to check in. How are you getting on? Is everyone okay? Even with an outpatient setting. So I sit within an outpatient team, an MSK team, even though I'm rheumatology. But, you know, we'd have regular still, you know, 15 minutes on a Monday. Is everyone okay? Anyone who was in the hospital, let's have a quick face-to-face catch-up, socially distanced. So that was really nice. And I hope those things kind of continue.
Yeah, so it's interesting talking about that and checking in with colleagues, because as we can see coming in from the poll then, so the central word is fear in the lead up to this and through, you know, the peak itself. It's fear and worry and uncertainty and anxiety. So and you know, we will send a copy of the results of this through with the certificate after the session is finished, so you know, people can reflect on it subsequently. Let's move on to the second question then, for the poll. And that's talking about the subsequent period. So what are your thoughts and feelings now in the so-called living with COVID-19 phase? So we'll give that a few minutes just for responses to come through. And perhaps we can just have a little look at the questions whilst some of the responses are coming through. So there's a question here from, there's some Excellent things here. Elizabeth, health psychologist, picking up on the themes of self-care and working with uncertainty. And it sounds like there's a helpful resource that she may well be able to forward on to us. So Amanda's put a question on the chat function. So how will you look after your own mental health and encourage patients that they should attend hospital appointments? So that's really tricky, isn't it?
Yeah, definitely. And I think that's something that now, particularly as a wider rheumatology team, so my consultants, clinical nurse specialists, are finding that's kind of the issue at the moment. So obviously we've still got a massive cohort of patients that are technically in the shielding bracket. So that doesn't end until end of July, beginning of August. And we'll have those patients that aren't in such a vulnerable category that we maybe really do want to see face-to-face as safely as possible. So, thinking about even our new possible early inflammatory arthritis, wanting to do things like the joint counts, tests, bloods, imaging, that actually they're too fearful still at the moment to come into the hospital. And I think, throughout our clinical roles, it is always patient choice. We can only advise, and, what we're doing within the trust is kind of offering those face-to-faces that are appropriate, letting the patients know everything we've done to keep them safe. For some of them, though, that's still not enough and they're still not comfortable to come in. And I think that's something that we're all going to have to kind of manage until things start to become a little bit more normal. So it's going to be a really tough time, but yeah.
And the becoming more normal, obviously we don't know when that's going to be. And so again, going back to the question, the living with COVID-19 phase, if we can call it that at the moment.
Yeah.
So and that's interesting. The two central themes are ongoing anxiety, even at, in this phase of the pandemic, but also relief. That's interesting. I think caution as well. That's very relevant for this current phase. Yeah. So thank you for all the responses from the poll. As I said, we will collate them and they will be sent through with the certificate at the end. So when looking at the questions then again, so there's a question from Mark, and Jane, perhaps you can help us with this one. I found it stressful learning of colleagues at work who've become ill with COVID-19. Have you got any tips for managing this?
Yeah, because we were dealing with colleagues who were becoming ill, relatives who were becoming ill, and then we had there was death in service that we were dealing with too. I mean, I'd never dealt with death in service before, so there was all of that as well going on. I feel that Fern's covered it in some ways. It's making sure that we don't bottle things up. It's making sure that we talk about things. It's making sure that we ourselves follow there's the practical PPI, as Fern has said, around how we make sure we're protected, because we've seen others who've become affected, which makes us feel more nervous about where we are or affected by that. But there's also something about what we do with the emotional side of how we feel when we sense colleagues that we love dearly, that we are used to having around when we know that they've been suffering or they're suffering, that we make sure we get adequate psychological or whatever support works for us. I think what's already been touched on is that all of us are different. So some people found psychology services was supportive. Some people found the chaplain was. Some people found lying in the sleep or the rest room was, or a game of table tennis was. Some people found different things, and that we can't say one size fits all. But what I did observe when colleagues got sick, the other thing I observed about what Mark's question was how colleagues feel so helpless, and they really want to try and fix something and what they feel they can do about that. And there's something around the balance between enabling them to look at how they could support the situation and support one another versus how they allow themselves a space for their own sense of what's going on and how they need to deal with that situation.
So thinking about sort of moving forward, and then also, Fern, you touched on sort of disseminating those Nightingale resources to be used locally. Are there particular resources that either of you can signpost people towards? Because there's obviously a lot of questions coming through on the chat about resources and links and things that may be relevant for people moving forward. So Fern, do you want to go first? Yeah,
so obviously the slide that I shared, was part of the bigger package of the Nightingale resources. So that's just on the Health Education England website. So you can just put it through Google and that will come up. I think, you know, other resources that I know a lot of our colleagues have used and found really useful are your apps that are out there as well. So, you know, Headspace, Calm, I'm sure their downloading has gone up greatly. And like Jane said, you know, everyone manages this differently. So it's just, it's kind of, again, checking back in with yourself. What are my coping strategies? What can I try and utilize? There's so much support out there, be it with your trust, like I said, be it with apps and things like that. So those are the things that I would kind of be suggesting that people look into.
Great. Are there any additional ones that you would like to add, Jane, to that?
I'll look out. I don't know whether you have somewhere they can be posted, but I will look out some
Yes.
other things that I agree with what Fern has said, and also that people do things differently. One of the people involved the other day said to me that she joined a virtual choir and she learned the Messiah during the whole of in her spare time, and then did the Messiah the other night in the kitchen. But that for her was the way that kept her really supported. So what is also amazing is the amount of community resource that has come out of this, and the innovative ways that communities have, you know, whether it's a choir or whether it's community sewing or whatever else that people are doing. So I'll post some of the other things that people have done. And what I hadn't appreciated is how much you can do online, how much you can do virtually, and how much support you can get. We had things where people could just press the button and there would be a psychologist there, or press the button and there would be a yoga session there waiting for them to join. And I think those things are fantastic. I don't know why we didn't have them before, but they're there now.
Yeah, good. Well, we can certainly, we're also probably not going to get time to answer all of the questions that are coming through. So that'll all be collated and we'll try and respond to as much as we can offline as well. Just let's pick up a couple of others. So one of the questions is around what happens now to Nightingale?
I think that's a massive question that the media has definitely ran along with.
In 2 minutes.
In 2 minutes. Okay. So obviously it went into hibernation. Some people might see that as a negative. Some people might see it as a positive. I personally see it as a positive because there's no way I wanted us to ever get to the point where we had to use a 4,000 bed field hospital. The main thing that's happening at the moment is it's still there. It's still standing. It's still a structure because we're assuming that there might be the second surge, particularly, like I said, in the winter pressures. So I think the investment was still worth it. I think the education of staff was still worth it, because I'd rather sit here now and think, I'm glad we did all that and we didn't have to use it, rather than we get to a surge, we don't have any backup and things go AWOL. So it's still there in the background. Health Education England are looking at investing in their kind of critical care infrastructure. So they're actually at the moment kind of recruiting people via expression of interest to again rejoin that education faculty in preparation for this possible second surge.
Yeah. So much is still uncertain, isn't it, about you know, the months to come, and you know, I think this is so relevant moving forward, as well as reflecting on the last few months. So thank you to both of you. I'm really grateful to you for joining us all this evening, and it's been a fascinating discussion, and I could sit here for hours talking about this, and I'm sorry that we can't, but you probably want your evenings back. So so thank you very much. So just to conclude then, there will be a certificate sent out to each person who has logged on and registered for the session, and summary slides of the 2 polls will also be included with that. There will be a feedback survey. Please can you fill that out? It's so important for us to know what's working and what isn't working, and what sessions you want in the future. As Steph said, there will be more sessions coming, but you know, there's a process of consultation to plan those, so you can have input with them, and please do. Thank you all for joining us, and have a lovely evening, and all of you take care.